People are on this journey, their parents are getting older, or maybe it could even be their spouse that has care needs. And they're wondering, what are they going to do on care in the home versus looking at different senior living options.
There are so many options for retirement today in San Diego County, about 700 options. The most common scenario that I think I come across is one of the spouses has cognitive decline, dementia, and some type of dementia, and the other one doesn't. Now there are, and it's growing in number, there are some communities that have a transitional care where the two people can live together in an assisted living of transition, where there's some memory care that can be given in assisted living so the spouses can stay together.
My mother had dementia. It runs in my family. I think it runs in a lot of families, or whether it runs in your family or not, more and more people are getting it. You're juggling your kids, your job, your relationships, and you're starting to realize that your parents are getting older. You're probably worried about who's going to take care of your mom, who's going to manage her finances, and also who's going to pay for all of this. Today, we have our special guest, Jacqui Clark. She is a senior care consultant and also a certified seniors advisor. She's going to help you understand what to do, what your options are if your parents' care needs have changed, and if maybe it's not safe for them to live at home, or aging in place options. So Jacqui, thank you so much for joining us today.
Thanks for having me, Valerie. Very happy to be here.
Thank you. So people are on this journey, their parents are getting older, or maybe it could even be their spouse that has care needs. And they're wondering, what are they going to do on care in the home versus looking at different senior living options. There's independent living, assisted living, memory care, continuing care, retirement communities, and all of these options are really confusing. So when would they call you to help them with all of this confusion versus them going out to different senior communities and investigating themselves?
So that's a great question. I always say you can never plan too early. There are so many options for retirement today in San Diego County, about 700 options, including our small care homes. And there's sort of two models. If you want to be super proactive and you want to look into the future for independent and assisted living, I want to have it all planned out. That's one way. Or if you're waiting till the last minute where your care needs have become such that you're no longer safe to live at home. That's when you would seek, someone like myself, a senior care consultant. Sometimes we're called a placement agent as well. But I help families figure out what's the plan as mom or dad age in place or may need to move, and what are the options, what are the costs. So that's where I usually begin. That's when people call me and just say, I just have a lot of questions and I don't know what direction to go.
So what is the first part of your process in assessing what their needs are before you can recommend their options?
So the first thing I do is I try to establish a timeline. So what's going on with your loved one? And that means, do we need immediate care? Or are we looking into the future? I get clients, I would say 90% of the time it's immediate care, where my mother's been diagnosed with dementia, or my husband has Parkinson's and the stairs are getting difficult, so we can't go up and down them any longer and we need a plan. So I always try to help families figure out, how do we stay in the house as long as possible? And what usually happens is when it's no longer possible because of safety issues, always safety issues, then we start navigating the system. And we look at, where do you want to be geography-wise, what's our budget, and what kind of care needs need to be covered, because not every community can manage somebody's care needs.
We were talking about diabetes specifically,
Yes.
And I was surprised how important it is to be at a specific care center for your diabetic needs.
Right, and that is if you take insulin, which is administered through an injection, you must have a nurse on property 24/7. That's a California law, and that eliminates about 98% of the communities because they don't have nurses 24/7 on the property. They have them for 12 hours, 18 hours, But if you take insulin, then you're going to have to seek one of the few communities in the county, and it's probably add about $1,000 a month to the bottom line of your care. Now, if you take metformin, which is the pill form, you're fine. Anybody can manage that. So it just really depends on the type of medication you're taking.
And that's at later stages, because early on they could administer it themselves, right?
Yes, that's a great question, because what happens is we're anticipating a continuum of care. So most of the times, I'd say 99% of the times, the communities are going to be, no, we're not going to take the chance, because that can change on a dime. You have some kind of health emergency and now you're required to use insulin. That's they can't even manage it for a day. So they can't be put in that situation. So we really do look at long term. We don't look at just what's happening today. We're trying to look into the future, so you're not moving constantly.
Speaking about looking into the future, oftentimes spouses want to stay together.
Yes.
And
yes.
they age differently, right?
Yes, they do. That's a great question too. So what we do is, if in the most common scenario that I think I come across is one of the spouses has a cognitive decline, dementia, and some type of dementia, and the other one doesn't. Now and it's growing in number, there are some communities that have a transitional care where the two people can live together in an assisted living of transition, where there's some memory care that can be given in assisted living so the spouses can stay together.
Okay.
Some of the communities don't allow it, and again, it's a case by case, and honestly it does change a little bit, because I think more communities are recognizing the need. We have more cognitive decline than ever before, and people want to stay together. So, and it's really not appropriate for someone who doesn't have dementia, like in the middle of it, very advanced, to be in a memory care. So if that is the case, maybe we'll start them off in assisted living until it's no longer appropriate, and then one spouse will have to move to memory care at some point.
Can the spouse move in? I know it's more expensive for memory care, but could a person without dementia move with their spouse into memory care?
No, it's not really appropriate. It's very rare they even allow it. It's not really healthy for the person who doesn't have cognitive decline.
They need that socialization.
Well, and you could leave in the day. So there have been cases where the spouse may just, at nighttime just be in the room with them. And again, case by case, one size fits one, as I always say. And that's one of the reasons why you should consult help when you're looking for the next step, because everyone has a very individualized plan that they need to establish.
So then how do you recommend one senior community over another?
So it's all based on care needs, desired of location. I live in North County, I live in South County, I live in East County, or I want to be closer to a family member, and then budget. There's certain communities that just command a higher price point. So if your budget is at the medium point, and you're going to eliminate most of the coastal areas because they tend to be a little bit more expensive, but not necessarily always. Or again, if you have high care needs, mobility issues, advanced Parkinson's, advanced dementia, those are all expensive diseases to care for. So that will determine sometimes where we choose. If your budget is modest, we may have to go wherever you can afford.
So what about long-term care policies? Do people come to you with those in place?
Absolutely. And those things are fantastic, but I see that they're becoming fewer of them around. So 10 years ago when I started in this business, there's a lot, because a different generation, our greatest generation, our silent generation, they all have these amazing long-term care policies. You see a lot of teachers with them, a lot of government issue. So we have these great policies, but they have all aged out, so to speak. And we're now mostly with older boomers and some younger boomers. And I would say the majority do not have long-term care plans.
And so the ones that do, are insurance companies getting smarter and leaving out certain coverages?
That's a great question too. So the policies have changed. And today, if you buy a policy, if you're in your 40s and 50s, which I highly recommend, there's something called riders on the end of life insurance policies. There's not a ton of standalone long-term care because they don't make sense anymore for the consumer or for the company. So there's so many products out there. I always say, consult an expert in long-term care. because you want to make sure you're buying a policy that pays the most money and has an inflation rider. I think that's the most critical aspect today of long-term care policies is that there's an inflation rider. Because if you buy a policy that has a $3,000 a month from 1980, it's not going to do you a whole lot of good in 2025.
Right.
Although I'll tell you, sometimes $3,000 extra on top
Goes
of
a
what
long way.
goes a very long way.
Yes.
So it's never a bad idea to buy any type of a long-term care policy if you can afford it.
What are some of the other riders that you feel have been very valuable to have?
In terms of long-term care
Yeah,
policies,
especially dementia. I guess that's where my mind goes. My mother had dementia. It runs in my family. I think it runs in a lot of families, or whether it runs in your family or not, more and more people are getting it.
So if you have a long history of dementia in your family and you feel that your chances are good, the best time to buy those long-term care policies are early on, 30s, 40s, because you're locking in a lower rate. I had a very close friend who in her 30s found out that there was a very strong disease in her family, which every one of them would get. She was very smart. She bought an amazing long-term care policy. She pays about $130 a month, which is insane.
Yes.
She's in her 50s now, and she's needed to use it. She has unbelievable coverage, not just for assisted living and for in-home care, but she had a rider put on there where it not only was there an inflation rider, but she was able to modify her home up to $65,000. So she was able to have a bathroom where with a wheelchair access, you can put the rails on the ceilings, and it's making it so she can stay at home all the way to the end.
Oh, I love that.
So yeah, I mean, we have no crystal ball. But if we're smart and we plan ahead, it's such a benefit to you of knowing you have this policy that's not going to eat into your savings.
So when you're looking at the different senior communities, how are you helping the client select the location or the specific need?
Right. So I don't ever make the choice for a client because that's something they need to do on their own. What I do is I present all the information. So if they come to me and I do a care intake and I ask them everything about their history, what kind of diseases, and then I ask about activities of daily living, bathing, dressing, showering, mobility issues. I ask about weight. I ask about diabetes. I ask about, and so anything to do with any kind of illness that they're managing. If they're through cancer treatment, what type of cancer? Is it active? What's the prognosis? Anything from heart disease, AFib, anything that will affect mobility and activities of daily living. I get an assessment, and I have this nice handy dandy chart that I go through I've been using for years. It helps me understand what kind of cost we're thinking that they're going to have to deal with. There's also a state form in California called the Physician's Report that your doctor has to fill out. And they fill out, which basically discloses any type of illnesses you have, what your medications are, how it is administered. So every community has to have one of those
I've never
forms.
heard of that form.
Yeah.
So it's only if you move into a senior community that the senior community requires that?
Yes, and that's a California state law.
And what's that called again?
It's called the Physician's Report.
Okay.
And so your doctor will fill it out, and then someone from the community will do an assessment, and they will determine your care needs based on the physician's report and their own assessment, and that's what your care charges are based on. Now, I do a pre-assessment by asking all the questions. So if you come to me with your mom and she says she has dementia, she's incontinent, she uses a walker, she needs help getting in and out of chairs and out of the bed. She needs help bathing. So do you need help bathing with hands on someone, meaning I'm helping you shampoo your hair, I'm washing your face, or just supervision? Those are two different levels of care. So that can give me an idea of the cost. So if they come to me and say, we have a $10,000 budget and we have two very high levels of care for each spouse, I'm going to say that's going to be a tough budget to do, and we're going to need to go to A, B, and C community, and then we'll go and tour them together, and then we can, together I can answer questions and they can make a decision based on what I'm doing. Is I'm saving them tons of times. There's 700.
Yeah.
Especially if your friend says, hey, we went to, assistant living, D, and it is amazing, you should go. But guess what? you have a prohibitive disease, which says you're not allowed to go there, or one of your spouses is going to have to go into memory care.
And you've done all of this research.
I've already done the research. I've walked through all the communities, and I keep up with the changing regulations. I keep up with the prices. And so I just save a lot of time, so you're not being frustrated, taking time out of your busy schedule, visiting them on your own, only to find out, oh, wait, I can't afford it, or they're not going to accept my parent, or my parents are going to have to be split up.
Right. So with all the research that you've done, that sounds very expensive to hire you. How do people pay for you?
Another great question. Lots of them today. I am no cost to anybody who needs to use me to find assisted living. I have contracts with all the communities, and I get a percentage of the first month, much like realtors do when they sell houses. So that's a benefit to the client.
That's a relief.
It is, and the communities like working with placement agents because we bring them clients that are appropriate for their community, because they also don't want to do tours with someone who will be disappointed when they can't afford it or their care needs doesn't match up. So we help both sides of the equation. And, I mentioned I was a certified senior advisor. So part of it is we take an oath to do no harm to seniors. I am background checked. I carry insurance, and I can be sanctioned for unethical practices, which I think is a huge advantage of using a certified senior advisor like myself. So
absolutely,
pretty proud of that, I have to say.
It's a lot of work to get your CSA.
It is, and I know you just received your credentials, so congratulations.
Thank you.
It is a lot of hard work, and it doesn't end after our test. As we know, every 3 years we have to have 30 units of continuing education, and we pay a yearly fee to keep our credentials up to date. So we're constantly learning, which is amazing.
Yeah, and there's always something to learn.
Yeah.
Hi, friends. I want to pause here and speak directly to the sons and daughters listening. If your parents' health is changing, if the house isn't supporting them the way it used to, or if you're stepping into decisions you never expected to be making, you may be trying to figure out who should be helping you right now. Well, there's a lot of voices in this space. The key is knowing which one actually fits your situation, and that's where a discovery call can help. During that conversation, we look at your specific circumstances and get clear on what needs attention first. It's about helping you identify the right next step and the right professional for your situation, so you're not guessing or reacting or carrying the weight by yourself. If having that kind of clarity would steady things for you, you'll find the booking link in the show notes. Now, back to the episode. So what about, families are spread all over the country these days. Can you help people from out of state?
I do. I work a lot out of state. In fact, I have about 4 or 5 clients going that are out of state. And how it usually works is either I have the adult children living out of state who need help in California, or I have the adult kid in California who has a parent living out of state. So I partner with other certified senior advisors and senior care consultants in other states that I've known for years, kind of basically a mirror of what I do. And we work together to help their loved one out of state. And again, I'm sent leads from out of state to help someone locally because I feel like I've built up a reputation of trust.
Yes, you have.
My own parents are passed now, but my mother went through 12 years of dementia, and this is what kind of got me into this field. I'm very passionate about helping families figure out safe options at the end of life. So that's where it all started. And so I have it's my passion project, my last career after 25 years of being in public relations. So it's soul work, I always say.
And so if people are choosing to go and investigate the senior community on their own, and they've already visited a place, then that place probably won't be able to pay you. So it's important they contact you first.
That is the preference. Now, occasionally we can work something out, but yes, we always appreciate if you go with us first so we can put in the referral. But there are people obviously who do it on their own. And my advice would be, if you're going to do it on your own, do your homework.
Like what questions should they be asking?
So the questions should more be like, look at the reviews, go in, check it out. Because I always equate assisted living to restaurants. Because think of your favorite Italian restaurant that you've been going to for 10 years, and it has the best chef. and the best service, and everything is fantastic. And then it gets sold, and the staff changes, and there's a new chef, and the menu changes. It's not the same place anymore. So you really need to check out these communities. When you're ready to go, you need to walk in the front door. You need to ask appropriate questions about care violations, your costs, how does the cost and the care increase yearly, how long the staff's been there, how long the care staff has been there, because that's truly who's going to be taking care of you. Check out the property. Is it in good repair? Does it have everything you're looking for? If transportation is really important, how accessible is it to you? Will they take you to your doctors? Is your doctor within usually the 15-mile radius that they offer? Is there a town car? Is there activities that interest you? Is there outings? So there's so many questions to ask, and it's overwhelming when you really don't know what you don't know. And that's my job, is to let you know. If you tell me, my mother loves to learn, she likes to go to the flower fields and see theater, and she likes to be able to take a walk every day. Well, I'm certainly going to make sure there's walking paths, maybe there's a walking group, there's a super outgoing community. I'm going to match them up with the right boxes that they want checked, as opposed to some of the communities maybe aren't as active.
Does that exist in San Diego, what you described?
Oh,
with the
absolutely.
walking paths
Oh, for sure, for sure. And there's so many, and because we have so many microclimates, and just the way we build our community, some are on huge acreage, some are small footprints, which have complete advantages when you have mobility issues. You don't want to be in a giant community. That's something that I point out. Like, if you're telling me that your mom has a very difficult time going from her bedroom to her kitchen, I don't advise moving into a huge, large community where she has to walk a substantial amount of times, 3 times a day, to get down to meals. I would recommend a smaller footprint.
And we had to move my mom from a room at where she was in memory care because it was so far to get. And early on, it was great because then we knew she got exercise. Right. Then later, it became more of a risk, so we had to change rooms.
Right. So there's just a lot to consider for each person. And again, one size fits one. It's a big decision. When you buy a home, when you send your kid off to college, when you buy an expensive car, you do your research, you use professionals, and this is no different. This is one of the largest investments of your life. With what assisted living costs now, the average is per person around $6,500.
$6,500 for assisted living, independent living. What is that baseline?
So assisted living, memory care, that's about per person. That's about the average. And again, it depends. If independent living, if you're truly independent, that means you have no care needs. You're just maybe going there because you don't want to keep
rent,
right.
Basically,
you rent, and rent includes your meals, all your utilities except for a phone. So you can, depending if you want a studio, 1 bedroom, 2 bedroom, depending if you're at the coast, if you're inland, if you're in Forest Ranch as opposed to maybe Vista, they're all different prices. Yeah. It will still be, let's say, a studio. You're still looking at the very bare minimum in the 4,000s sometimes, and then it could go as high as 10,000, just depending on square footage and location.
So there's some families that want to age in place.
Yes.
And their adult children may come to you and say, you know what, I don't feel like they're safe anymore. We really think it would be appropriate if they moved. What do those conversations look like? So
those are really tough conversations. So I try to coach the adult children on some things to say, but sometimes I need to go and sit down with the with the parent and talk to them about, we are trying to involve you in this decision because you are adults, you're not children, and we want to keep you safe. But if you do nothing, eventually we'll have to make decisions for you. You will fall, especially if you're having mobility issues. If you have a parent with cognitive decline who's exiting the home, there's no reasoning there because their reasoning is mostly gone. So that's up to the adult children to make the hard decisions of just moving the parent. But if we have parents with mostly mobility issues where it's unsafe for them to go up the stairs, or they're constantly falling in their house, bathrooms, if you're in an old house, are not accessible for wheelchairs, walkers, if they don't have walk-in showers and they're stepping over the lip of showers. So you can get help to come in the home. You can be the person But if it comes down to I can't afford in-home care, or I don't have the time, or I just don't want to be involved in that, when you need to move, which I just had a conversation recently, I just kind of say, I look at what's happening and I just am very truthful and I try to keep their dignity, because that's really what aging adults want.
Yeah.
They want choice in their dignity. And I make sure I give that at every opportunity I can by just talking to them like I would talk to any other adult, like I'm talking to you, saying, if you don't make the choices when you need to keep yourself safe, they will be made for you. You will fall. You will fall, I guarantee you. And if you're unlucky and hit, a bedpost or the hard floor, concussion, breaks. If you go under anesthesia past a certain age, you have a higher chance of hospital delirium, which is a cognitive decline, and sometimes it's permanent. I do not know why. Sometimes it's not. But even in that, interim, you're going to need 24/7. And so you're creating a situation of more expensive care and less options. So I say make the options before you have to. Yeah.
Do you have anybody that you can recommend companies for in-home care to those families that do want to stay in
Absolutely. I work with several in-home care companies throughout San Diego County. I work with hospice, financial planners, real estate agents, long-term care specialists, geriatric care managers. I try to hit every lane of the aging process. I've built a really robust, valuable resources. So sometimes we do need to get that. We need to get a durable power of attorney in place. Sometimes we need to change our Medicare. I have Medicare experts. Sometimes the house needs to be sold to pay for care,
Does Medicare pay for their care?
No, great question. That's probably one of the number one is my mom and dad have amazing Medicare. How much will it pay for assisted living? And unfortunately, the answer is zero. Medicare is for medical care, broken bones, prescriptions, infections, hospital stay. But assisted living, memory care is what we call custodial care, where that's like living in your home. The care that we need is on us. If you are low income, which means your income is $17.99, single person or less.
So $1,800.
$1,800, yes.
Okay.
You can qualify for Medi-Cal, but that does not mean you're going to go to the fancy assisted living. They have skilled nursing facilities, and there's something called the Assisted Living Waiver Program, and I won't go down too far down. It's a whole episode. Yes. But that's a different lane, and there are professionals that I do work with for Medi-Cal services, and there's some programs. And if you think that's something that is in your future, you definitely want to get on the list. You want to get on the list quick, because sometimes there's years waiting on the list.
This is one thing you were explaining to me. So I've advised clients if they have a loved one, they need to get on that list to do it right away, even if they're not ready to move tomorrow, because the list can be 2 to 3 years long, right?
Okay.
But you were telling me that the money runs out a certain time of the year.
Sometimes.
Can you explain that?
So what happened is, and again, Medi-Cal in California, every 49 states call it Medicaid. We call it Medi-Cal, which means just that the dollars for Medicaid were given to the state of California, and all the states administer them. And we're a huge state. We're 39 million. We're the 4th largest economy in the world. So we administer our own Medi-Cal. So the government decides what lane the money is deposited into. The Assisted Living Waiver Program is a program that pays for care for seniors who need it. You must need it in the small care homes, a handful of them, not all of them, a handful of them, instead of skilled nursing facilities. And they've allotted a certain amount of money. In 2024, we ran out of money by September 1st. So they shut the program down. And they had to wait for the new year to get the dollars replenished.
So that means that people on the waiting list, they were just waiting.
They're just waiting
until new money comes in.
New money, yeah.
And beds open up.
Right, and beds open up. So January came, 2025, and unfortunately, we ran out of money pretty quickly in March. I don't know if it'll open up again or if it has, but it is smart to get on the list. Now, you can only get on the assisted living waiver list if you have care needs.
Yes, I understand.
But again, there's experts to help you qualify for that, and that's why I say, if your mother's been diagnosed with dementia and you're pretty sure she's going to qualify for it, you should start the process.
Got it. Okay.
You should start the process.
2 last questions. One is, what mistakes you see people making when they're choosing the senior community.
I think the number one is that they choose the community based on the chandeliers, as we say, how it looks, which looks are important, but sometimes a beautiful community is not delivering the care your parent needs.
Cleanliness matters, but beauty
always,
doesn't.
right.
Yeah.
Cleanliness must be spick and span, but an older building, but in amazing condition. It's clean, it's fantastic, it has your right price point, excellent care, is just as good and sometimes better than a beautiful brand new community who just doesn't really have it together yet. Again, back to the restaurant. We walked into an amazing restaurant, terrible. We walked into a hole in the wall, clean, amazing food. So you really have to be discerning every time you look. And it changes, based on staff and who owns it, because they do get sold. And then that's amazing, yeah.
And when should people call you?
As I would say, if you get a new diagnosis, you should start making your plan of what's going on. If you see that one of your loved ones is not doing well at home and you're visiting more, call me. And if you're like a senior, like I had a 75-year-old senior call me the other day, super fit, and she's like, I want to plan for the future. So we're planning. We're 5 years out and we're planning. She wants to know what the cost is and what's important to her, so I know. So
Perfect.
We're ready.
Wonderful. Thank you so
You're
much
welcome.
for all
Thanks
of this
for
great information. I think you're going to help a lot of people.
Thank you, Valerie, for having me on. This has been wonderful to be here.
If you would like more information, we'll have Jacqui's information below, and feel free to reach out to her or I for any of those needs.